I don't actually have it broken down by healthcare worker at the moment, but I can find that information for you. There is a large number, if we look at even the long-term care facility outbreaks that we're talking about, there's in the vicinity of 55 healthcare workers involved with those outbreaks, but I can find that information. And in terms of contingency staffing, absolutely. There's a very detailed planning been going on, looking at not only how can we supplement staffing at the long-term care facilities that are under an outbreak, but also how do we ensure that we have staff who are able to care for people who have COVID-19 in the hospitals. And there's backup plans for how we can do that. You may have heard in the last few days we've asked recently retired physicians to volunteer. We will be looking at things like triaging, so there is many different sources of work that a physician can do other than actual one-to-one patient contact. So we may not have older physicians, for example, provide patient care, but they may be able to provide virtual care and help with managing people who are in isolation at home, for example. And then we also have called up all of the residents and medical students who are no longer in clinical rotations. We've also got nurses who have either recently retired or are working in areas that are now closing down in the hospitals to help support things. And there's a strategy that the health authorities are working on for ensuring that the right people are providing the right services in the most safe way. So it is complex, as you can imagine, but that work has been started when we started our outbreak response, and it goes on today.
Just to add, Justine, I think we're going to have information about the re-registration of doctors and nurses in the next day or so you get a sense of that part of the equation, which is an important one. It's one of the reasons why we've taken the actions we've taken in acute care that we've described before, and especially the very strong actions that are being taken in long-term care to ensure that both our residents and healthcare workers are safe. But it also speaks to our obligation, I think, to the people working in healthcare to follow in the community, because healthcare workers frequently get COVID-19 in the community. And so we need to take those steps so that they are protected to the maximum possible. And that means, as I say, that people follow the recommendations and the orders of Dr. Henry at 100%, because it's critical that healthcare workers are protected. They're a huge part of our system in terms of the response, but also the people that healthcare workers work with are by definition extraordinarily vulnerable. So part of the reason why we have this obligation in the community to ensure healthcare workers are protected is that. And I want to say finally what I said, I think, in the discussion is the extraordinary role played by those who represent healthcare workers in all associations and in unions and in the community. Everybody has stepped up to the plate to deliver everything they can on behalf of patients and residents in BC. And that has involved very significant changes that are suggested in long-term care and the orders of medical health officers, but also the necessary changes to ensure that people are protected. And I would say in the case of all of those unions, everyone has stepped up in the public interest, and we're very proud of what they've done and very honored by their involvement in all of this.